Hey guys, Luis Moreno here with 360 Insurance Group, and I am with Jordan from Health Sherpa, and we're going to be talking about an issue that some agents have to deal with, and that is DMI resolution and best practices to avoid getting DMIs. So, Jordan, let's just jump in here because we throw a lot of acronyms. What is a DMI and how can agents avoid getting DMIs?
Yeah, great question. And thanks for having me here today. So a DMI stands for a data matching issue. And there are three reasons that you may be generating a DMI when working with your clients. So we'll share all of this information with you for reference, but the first reason is typically because of incorrect or missing information on the application. These are often generated when a client did not provide a social. So I hear this all the time. Agents don't feel comfortable asking for a social. Maybe their client says that they're not comfortable providing it. It is so important that you try to collect this information. I know that it says that it's optional on the application, but if you don't collect it, you will be required to provide additional information later, otherwise known as a DMI. Another example might be a client didn't provide all of their household income. So they've got a few members in the family and all of the members are receiving income, but you don't provide all of that. So you're going to need to provide some documentation later on that. And the third reason might be a client did not provide an immigration document and their ID numbers. So there are many places on the application where you might see something as optional, or maybe your client says, oh, I don't have that right now. I can't stress enough how important it is to say, we really need that to proceed. You're spending all this time supporting your clients. Make sure they give you the information you need so that you can get them enrolled, keep them covered. The next reason would be inconsistent information. So these are often generated when a client's name on their application does not match other documents. Another example would be if their annual income has changed. So again, inconsistent information is the second reason we see a DMI generated. And the third would be unavailable information. So let's say your client did not file their taxes. And when you are working with them and we search the marketplace for eligibility and their information is not available, it's going to generate a DMI and you will have required follow-ups.
And I'm going to tell you this, guys, you don't want DMIs, okay? It does happen, but I'm going to talk about my best practices because we've written quite a few, and a small percentage, I do have a DMI issue, but I'm going to talk to you about some best practices. And I'll even tackle the social right now. I will tell you, Jordan, when we get to socials, if you're hesitant, you're going to make them hesitant. Yeah. Don't be afraid. The other thing, and I'll talk a little bit more about this, but this is sales 101, I think. If I start gathering data, I'm just not going to go for the kill right now. Okay. I'm not going to go, Jordan, what's your social? No, I'm going to ease into it. Hey, Jordan, give me your full legal name. Jordan, I need your phone number. Jordan, I need your address. Jordan, I need your email. So she's already in the mode of giving me information, and then I just slip it in there. And Jordan, what's your social? And she'll start talking, she'll give it out to you before she even realizes or has a second thought about it. So don't go for the kill immediately. Try to gather it slowly. But definitely, and I'll hit on some of these other topics about that you hit on the previous slide. But that's just a little sales 101, ease into the asking of the social.
Yeah, that's a great point there. And I think it's also just very important to understand how DMIs may impact your client. And I think if there's hesitation about providing a social, you could explain to them that they're going to need to provide you that documentation later. So you can save both yourself and the client a step later if they give it to you at that point in time. If you generate a DMI and it's not resolved, your client will potentially lose their subsidy and or their coverage. So I think helping them understand, hey, we're going through this application together. If you don't have this information now or you can't provide it later, it will impact your coverage. So I think at the end of the day, that's the most important part here, is that if a DMI is generated, it has to be resolved, but do whatever you can upfront to not create a DMI in the first place.
Jordan, can you go back one slide?
Sure.
Okay. All right, guys. Let's talk about some of these DMIs. So the social, one of the things, again, don't go for the kill right away, but do let them know what Jordan said. Hey, you're going to have to give it to me at some point. It's got to get entered. Otherwise, this ain't going to, this policy that you want just not going to happen. Okay. Right. But don't be afraid to ask for it. We need it in case one of those things. Income. There's got to be a black box of what creates a DMI income issue. Normally, just so you all know, healthcare or this entire process of an application, it communicates with some 3-letter agencies: IRS, I think Homeland Security, Immigration. I think that's part of Homeland, but it communicates with these 3-letter agencies, guys. And so as you're entering the data, it's checking to make sure that you're entering the right data. Now, somebody gives you a social every now and then. I mean, I'm not perfect on the keyboard, but I'll have a typo. Or if they give me the information wrong, okay, sometimes they get the kid socials mixed up. It happens. You're going to get an issue that says, hey, something's wrong. And there's usually a eligibility will tell you, give me their citizenship, their date of birth. You got to provide all these things. I'm like, oh, geez, I put a wrong social. I screwed up on, something went off. So I think agents, just don't be afraid to ask for that social. You're going to have to get it from your insurance. Income, same thing. Don't be off on the income. I'm sure there's a little bit of a threshold, but if you're way off beyond that threshold, you're going to get an eligibility requirement to prove it. And it's not a big deal, guys. If you go through my past trainings, verifying income, you can use a pay stub. You can use a tax return. You can use a letter of explanation. Sometimes people make less money. They lost a job. Maybe a spouse quit working to be a housewife or a house husband. You never know. So a letter will solve that issue. And then this is the big one. And this depends on your area. I'm in San Antonio. I'm 2 hours from the border. I deal with a lot of resident aliens who have a green card. Okay. When I enroll somebody and I ask them, a U.S. citizen, they say no. It's like, you have a green card, right? Yes. Okay, great. I need you to send me a picture of the card back and front. Usually, I get no fight on it. Like, okay, great. And what they do is they snap a picture with their phone and they give it to me, because you have got to enter all their data, guys. There's some information on the front of that green card, and there's information in the back of the green card. So just like Jordan said, just because it says optional doesn't mean you got to forget it. You need to enter it. Otherwise, you're going to have to get an eligibility that requires you to enter it later. So get it all done on the front end. Inconsistent information. I see this happening on socials where they give you one name, especially let's say they give you a maiden name and they've gotten remarried, and you're using the new married name, but they didn't change it on the Social Security. That will create an inconsistent DMI. Okay. Another thing that I may see is the green cards. So, okay, don't get mad at me, people, but you will see you're putting the guy's name as Juan Rodriguez. Okay. But on the green card is Juan Rodriguez Gonzalez. It's got a huge, just typical Latin America, Central America type deal. So you got to put all those names. There's a space on the application where you say, is the name on the green card the same as the application name? And you'll put no, and you'll enter how it's listed on the green card. Make sure that you do that. Okay. So I think I tackled those. Okay,
Yeah,
go ahead.
great points.
Keep on.
Yeah, no problem at all. And for anybody that's new to Health Sherpa, we have a ton of tools right in the product, and we'll talk about this in another slide, but you'll see in Health Sherpa, if you do happen to generate a DMI, you're able to support uploading those right from Health Sherpa. We'll even tell you what documents are accepted. So if you're not sure, or the first one that comes to mind, your client already told you they don't have that, you can look through the list and even see things like an attestation form. So just like you mentioned, if the client lost their job and they can't provide proof of income, they could even write a letter. The point here is that doing something is better than doing nothing.
And guys, down in the description below, I'm going to give you a couple of my a couple of things that I use to help out. I'm going to give you a income attestation letter. All you got to do is customize it for your insured, have them sign it. So I'll give you, and I'm going to write notes down so I don't forget. So I'm going to give you the income letter. Here's the other deal I'm going to give you guys. I'm going to give you my intake sheet. Okay. My intake sheet gathers all the data that's needed to process an application. So click on the description below and I'll have an intake sheet. It's a Google Sheets that you can download, and it's got all the data that's required. Again, I don't like to enroll people without social. So I tell them, if you don't want to give me your information, go find somebody else. Go be their problem. Okay. I'm a professional agent. I've been an agent for over 22 years. My family works with me. I'm not going to go anywhere, and I'm not going to compromise you. Okay. But in order for me to do my job right, you got to give me all your information. I'm like, oh, okay, fine. And then they give it to me. All right. So I'm going to share some of my stuff down in the description below.
I can add that I've seen a lot of your resources that you provide to agents. And for somebody that works really closely in this space, everybody check out Luis's documents and resources that he shares. They're all awesome. And
now I'm going to give you those items, guys, but I do have an ACA Smart Book that I sell. It's $50, guys, but it's lifetime access to it. I update it every year. It's got your federal poverty chart on there that you can utilize. It's got sample green cards, so you know exactly what data you need to enter. It's got sources of incomes. It's got the special elections. It's got all kinds of stuff. It's good stuff in there, guys. Anyway, I'll put a link for that too if you guys want to purchase that.
Definitely check that out. I've seen it and it's awesome. All right, so we'll just cover a couple more topics here on DMIs. So again, we talked about why it's important to resolve DMIs. So the first reason is that your client could lose their subsidy if the DMI is not resolved. And if your client loses their subsidy, they're probably not going to pay the full price premium. They're going to lose their coverage. So everybody loses in that example there.
Right.
The second one here would be loss of eligibility. So if a citizenship or immigration DMI is not resolved, your client can potentially lose their entire eligibility. So we're not just talking about the subsidy here. We're talking about eligibility to enroll in coverage. So then that would also result in loss of coverage. So everybody loses in that example. So super, super important to take care of these DMIs.
And guys, I'm going to give you a pro tip here, guys. Okay. I scare my insureds. So I will tell them, and I scare them in a good way. Okay. So if I have a DMI where it's this lost subsidy, I will tell them, look, you're paying maybe $0 for this health plan, but without this subsidy, you could possibly be paying $1,300. Okay. Now, if you don't give me what's required by this time, and I don't give them the full time, guys, this is sales. Okay. If you give them till May, they're going to wait till May. Tell them, hey, by the next 2 weeks, if I don't get this, you're going to be out of luck. You're going to get a bill for $1,300, and I'm not going to be able to help you out. There is no way I'm going to go fill this. There's a form. What's the appeals form? I don't know how long it is, but it's just way. I'm like, no, I'm sorry. So you know what? Here's what you need to do. And again, here's another part of this pro tip. Here's what I want you to do, Mr. Client. You got your pay stub? Get it from me. Here's what I want you to do. Because I'll tell you, I don't have a scanner. I don't have a printer. No big deal. All this stuff, guys, everybody's got a smartphone with a camera. Okay. You don't need it to be scanned to you. You can just tell them, take a picture. Okay. This low income letter that I use all the time, you can just tell them, look, I want you to write this out on a sheet of paper. Write it on a napkin. I don't care. Just write this down. You give them some information. Hey, this is what my expected income is for 2023. I'm self-employed, or whatever it may be. A little explanation, sign it, take a picture of it. Just tell your insured to text it to you. The green cards, text them. Pay stubs, take a picture and text. Some of these people don't want to email. Texting is so easy. Utilize that text, that ability for them to text to get all the data you need so that you can handle these eligibility requirements.
Yeah, great tips there. All right, and then just a couple of other things I'll share with you all. So if you're brand new to Health Sherpa, definitely participate in one of our trainings. We do a comprehensive overview of everything you need to know about the tools that you have available to you. But specifically when we're thinking about DMIs, you're able to view these right from your Health Sherpa account. So here I've got a screenshot of what the agent dashboard looks like. And if you're in your clients tab, you can go to the document section. This does pull real-time statuses from the marketplace. We are the only ones in the industry that provide this. So this is a super helpful tool. You come in here, you can use this dropdown to select action needed or insufficient documentation. And then you'll be able to see a list down below of who has action needed, or maybe a document that was uploaded was insufficient. You'll see that. And you can even filter this list by clients that have action needed the soonest. This is one tool you have available to you. We also will send you a daily digest of who has action needed. So any changes in the last 24 hours. Does somebody need to provide documentation to you in the next 24 hours or risk losing their subsidy? You can see all of that in email. We also implemented this past year a client email reminder. So again, talking about optional fields here, I know that the marketplace sends out a lot of emails. I know that your clients receive emails from the carriers and they get confused. But if you are able to capture an email address, this is just another tool to help you. So let's say you generate a DMI and you did collect an email. Your client will actually get an email from Health Sherpa at 15 days, 5 days, and the day prior to those documents are due, reminding them what the document is, how they can log into Health Sherpa and do it themselves, or how they can contact you. So we've given you a lot of tools right in the platform and at the client level to take care of these DMIs.
And then the other deal, you pull this list up and they're not responding. You start calling, hey, Mr. Client, you're near the deadline. If I don't get this document, your rate's going to go up.
Yeah.
And here's what happens. Clients are clients, guys. We all know them. I never knew about that. I'm like, baloney. Not only did healthcare.gov notify you, and they probably called you, but I know I sent you 3 emails and I didn't. Health Sherpa did on my behalf. Plus my phone call, I'm like, no. You are very aware of this. Okay. And just roll with it. On the emails that Jordan mentioned, I've seen agents put their own email, and I don't know why they do that. I think they're trying to prevent AOR changes. Stupid. Never do that, guys. You need to be putting your insured's email in, right? In fact, I don't even think it's legal for an agent to put their email on there.
That's correct. You will get flagged if you do that, and your applications may get blocked in our system. So don't put a fake email on there, and definitely don't use your own.
Yeah. And that way these insureds are receiving these notices, and that way you can call them out. I'm like, no, sir, Mr. Client, you got 3 from me. You got a bunch of them from healthcare.gov. I can't help you take care of your business. I'm like, I'm sorry, your rate dropped, went up to $1,300 and they drafted that from your account. Okay. Now, guys, I will tell you, me personally, I put all of my people on drafts. Most of them have $0 premium. So of course, nothing to set up, but if they have a premium, I don't even give them a choice. It's got to come out from your account. I'm sorry, that's the way it is. And they're like, oh, okay, fine. Don't give your insureds a choice.
Yeah, great point. So best practices here are really try to prevent generating DMIs in the first place. If you do generate them, understand how to manage them yourself, but then also educate your clients on why it's important they give you additional information, whether at the point of the application, whether you're using an intake form or after a DMI has been generated, helping them understand the importance of getting those resolved.
Beautiful. So
Awesome.
Guys, you got all the scoop on DMIs. Try to minimize them. Again, we want our insureds to have a smooth, easy process here when they're enrolling. So just make sure that you minimize all that, capture all the data. And remember, down below, guys, I'm going to give you my intake sheet. So just download it, utilize it. I'm going to give you my income verification letter, a template that I utilize. And I'm going to give you a link to get my Smart Book if you decide you want to purchase it. Guys, it's $50. I would take, I take 2 of my kids. I got 3 of them. Well, I got 4 now. I just acquired an exchange student, but I got 3 of them that are mine. And I tell you what, 2 of them at McDonald's, and I'm over $50. They each want their own 20-piece nuggets and large fries, large Coke. And then my oldest is like, Dad, can you give me the basket? In addition, I'm like, $50 at McDonald's. So you're going to get a resource here that's going to help you with your sales, guys. And every year when I update it, you just got to go right back in and download it. So take advantage of it, guys. Minimize your DMIs. You'll make more money. Your insured will be happy. And, utilize Health Sherpa, guys. It's the best tool in town. Thank you.